So, my name is Casey Sheldrup, and I will be showing you my presentation for the VOW assignment. So, what I decided to do my assignment around was the issues surrounding affordable and equitable healthcare in America. In 2010, the Affordable Care Act, also known as Obamacare, was passed to help make health insurance more affordable, more accessible, and fair to people in America. The Affordable Care Act was also put in place to help dissipate the long history of racial discrepancy in health coverage. While millions of Americans have benefited from Obamacare, African Americans are still more likely to be uninsured than their white counterparts. Then, one of the articles I found that was really great that talked about this issue quoted, the average family spends $8,200 or 11% of their family income per year on health care premiums and out of pocket costs for things such as office visits, co-pays, prescription drugs, and um, out of plan, not planned medical bills. And it is definitely detrimental to family incomes for sure. But for African Americans, the average annual cost for healthcare premiums is almost 20%, which is almost double what it is for white Americans for the average household income. The major cost to bear when talking about income is inequality and other economic changes for this demographic. So, for my summary to continue, the Medicaid program has made really great strides for lower income families. And a large portion of those families in America are actually African American families, which proves how important this program is for not only these communities, but for our nation in general. Some states in the United States have not expanded Medicare, though, under the Affordable Care Act, and African Americans and other people of color most likely will fall to within the coverage gap. So they either make too much or they make just enough to where they're not qualified anymore under the Obamacare Act and Medicaid. This means that these groups are either making too much to be covered, like I said, despite those families still being in the lower class income. Then another quote from this article, which was super amazing. It says disparity still exists across health conditions when comparing African Americans and whites, including maternal mortality, infant mortality, heart disease, diabetes, cancers, and other issues. And this was a big thing for me. I think that the Affordable Care Act, put in place has done strides for the African American community, but obviously there's still a huge discrepancy in equity for African American families and even, other families of color. And I think this is a really big issue that doesn't get talked about enough. And I think this is really great to be shown in a classroom setting, especially in elementary age, because at the end of the day, health insurance is something everybody's going to have to face, whether it's as a child or as an adult who has children one day. Health insurance is going to be something everybody has to deal with. So why this topic is relevant to social studies. The more educated Americans are about social justice issues, especially this one, the better they are equipped to solving issues facing not only African Americans, but people in color in general. Discussing this topic at a young age, like I said, will not only help understand the importance of this issue, but allow them to see the advancements of the field of medicine and where they need to be for everybody and not just white folk. Um, Everyone needs health insurance. Like I said earlier, everybody's going to have it one day. And in order to apply problem solving skills in their lives, they must be able to discover problems within their society that affects a lot of people and discover ways to combat these discrepancies. You can't equip people unless they know about the issues. And I think talking about this from a young age is really important to do. So for my TEKS, I did 5th grade social studies. For the knowledge and skills 22, science, technology, and society. And the students understand the impact of science and technology on society in the United States. The student is expected to explain explain how scientific discoveries and technological innovations in the field of medicine, communication, and transportation have benefited individuals and society in the United States. So I think this really applies to this because I I think they don't understand the impact that medicine has and how medicine can impact different families in different ways. And I think this is a really big issue. And the discrepancy that is shown for families of color, especially the African American community, is a really big deal that not a lot of people hear about until they're older. And then 26 as well, social studies skills. The students use problem solving and decision making skills working independently and with others. The student is expected to use problem solving and decision making processes to identify a problem, gather information, lists and consider options, consider advantages and disadvantages, choose and implement a solution, and evaluate the effectiveness of the solution. So I think this fits into, deciding whether or not our healthcare system is equitable for all families in America and not just, white families. I think this is a huge deal that, kids should be aware of. This is something they're going to have to deal with for the rest of their lives once they're off their parents' insurance. And I think they should understand that this is not the same for everybody. This is a problem that needs to be solved and it needs to be addressed. And, kids can't know any better if they're not told any better. And I feel very strongly about this issue, and I found some really great resources. So this one here is actually a TED Talk that I have listened to and I really liked. So it says this TED Talk is about the United States healthcare and how it's extremely inequitable for minority groups, especially the African American community. It discusses how even with health insurance, African Americans have a higher rate of health complications and there are higher infant mortality rates. So it's been told over time that African Americans are never treated the same in any hospital setting, any patient care. They're never treated the same. And this is a big issue that I feel like isn't addressed enough, especially when it comes to, the maternity ward. I have heard that, African Americans don't feel the same pain, or that's what doctors perceive. And that they think that, African American women, are making it up when they say that they're in pain. And I think this is such a huge problem within our field of medicine, and it really does need to be addressed and it needs to be changed. And the only way we can do that is by talking about it. Um, this TED Talk goes on further to explain the cortisol effect and how racial biases cause these higher health issues in minority groups rather than just the white people. So like I was saying, there is a bias, especially among doctors and healthcare workers, that especially African American women don't feel the same pain when it comes to giving birth, or they don't really believe them when they say that there's something wrong. And I don't know why that is, other than just being blatantly racist. But I do think that the healthcare system is something that really is vital to our lives, but is also something that needs to be fixed because it is part of the systemic racism that goes on in this country. So my discussion questions, or how did this video make you feel? I would obviously, allow the students to listen to this video. We would talk about the subject before watching the video. And then I would ask them how it made them feel and why did they feel that way? What did they learn that maybe they didn't know? And how did learning that make them feel? And then knowing the entire population doesn't have the same level of health care despite having health insurance, what do you think we should do in order to fix this problem within our community? So the best way to start is, what can we do here right now? What can we do to fix this issue? I think being able to do this community by community will really make a huge impact. And, going out into the community with a class is super important. It lets them know about what the issues are going on within, their hometown. It lets them know what needs to be fixed. And then I think it's always great to have students come up with ways they could imagine this being fixed. Like, what do you think needs to be done in order to do that? Um, and my next question is, what do you think should be done to help provide health insurance to those who do not have it? So, despite even Obamacare being passed in 2010, there are still millions of people who don't have health insurance. And, some of this is because even with Obamacare, it's still too expensive. There's many different places that have, different health cares. And I think it's great to, give students those examples of, well, Canada does it this way, Italy does it this way, Australia does it this way. How do you think our our system could change to differ and could change to better other people's lives, especially the minority groups? How can we improve this? What would we suggest to improve this for everybody? And then my last discussion question would be, what do you think needs to be done to help solve or better the inequality we see in health insurance availability and quality? So, like the video states, it goes on to talk about how, especially the African American community, is not treated the same, and how they are not, seen as in pain as their white counterparts, which, like I said, is just absolutely horrifying to think of. But unfortunately, that's what's happening right now. And there needs to be, there needs to be something said, there needs to be something addressed. And I think it's really great to be able to, take this into their community and write letters to, the hospitals, um, talk to, people within your community and what they think about it and what would they do. I think this is a really great opportunity for students to see that there is an inequality in the life, and that we have the duty to make sure that this, stops, and make sure that our society becomes more equitable for everybody, especially in healthcare. So for the mini activity, I would have the students in groups come up with 3 ways that they would change and improve the inequality within our healthcare system. So I would group up the class, probably about 4 to 5, and then I would want them to come up with those 3 things, what they think they should do, and how we could do it. I would have them create a poster board. So this will be a 3-fold poster board, which I would give them about 20 to 30 minutes to complete. I would print out any pictures that they needed or anything that they would want to put on their poster for them. Um, and I want them to think about what needs to be done in order for the United States to be a better place for people of color when it comes to healthcare. And then the last thing, with your reasons, also provide why it's important to have healthcare and whether or not you think knowing about healthcare is important to their future. So I not only want them to come up with how could we improve healthcare, but I also want them to understand why it's so important to have equitable healthcare and why we should, really push this issue, and why it's important for everybody to be involved in healthcare and not just a certain few. Like I said, there are still millions of people um that aren't, in like a healthcare policy. They don't go to see anybody whenever something's wrong because they don't have health insurance and they don't have the money to. And I really think knowing why healthcare is important and what it does for you is the biggest reason to understand why it's so important everybody has the same thing and why everybody needs the same level of care despite the color of their skin. And then this is my resource. So I took all of my quotes from this one um, article that I found by Jamila Taylor. She was super awesome, and this article is super amazing. If you read it, it has a bunch of facts on it. Um, but I really think this is a super important thing to talk about. And healthcare, like I said, is going to be something that everybody has to deal with in their life. And it being equitable is the biggest thing for so many people. And I think this would be great to talk about in a classroom setting.